Thank you, Mr. Hamdan. I want to take this opportunity to thank Arabian Business Club for giving me this opportunity to present myself and Saudi German Hospital Dubai experience in this field. Ladies and gentlemen, welcome. We are here in Saudi German. This one? This one, okay. So let me start by introducing myself. I'm Dr. Reem Osman. I'm an ophthalmologist, and I'm the CEO of Saudi German Hospital Dubai. I started this career since October 2012, so it's 1 year now. Our hospital considered is the last hospital now in SGH in Dubai. It's a 300-bed hospital, and it's tertiary hospital. Anyone, I think, who passed through Al-Barsha 3 will see it. It's considered now like one of the landmarks in that area. I think within 1.5 years, the hospital now started up since 1.5 years. I think within 1.5 years, we achieved good success, and we were able to put our prints on the healthcare sector in Dubai. How we were able to achieve this, of course, by focusing on our work, focusing on the quality of our work, especially in healthcare sector. Always quality is important. So what's the key determinants for any healthcare facility to achieve quality is the committed and staff and competent staff across all levels, is the advanced medical technology and scientific infrastructure. Of course, always in each business, any business, we have to focus on the quality in recruiting staff. And this quality, this is the major factor in healthcare sector because you are dealing with people's lives. So this is something very important that we cannot simply deal without it. Advanced medical technology, which is the title of my presentation today, and also the hospital must have the scientific and the unique infrastructure that will enable the staff to work in it. What's advanced medical technology? The advanced medical technology will cover diagnostic equipment and treatment modalities that I will talk about it, the IT and medical services that the hospital will provide. Diagnostic equipment. In a hospital, like our hospital, I'll talk about the experience Saudi German Hospital Dubai. So we have a lot of up-to-date diagnostic equipment. We don't have the time to mention it all. We have automated lab. We depend on paperless system and very advanced IT system. Actually, we were achieved last year the #1 by DHA for the first hospital that achieving 85% of all DHA requirements regarding automation and paperless system. Our lab is fully automated from the doctor clinic, the order to the lab directly, the result will go back to the doctor, no paper at all, and the report will be sent to the patients. We have also the back system, which is very advanced radiology department, also automated and 100% paperless. One of the services in our hospital, we can't, as I said, mention all the services because it will take a lot of your time. We are focusing on the very advanced radiology departments, gamma camera for nuclear medicine, cath lab. We are doing a lot of procedures of cath lab, and we have one of the advanced cath labs in the area. In the hospital, my strategy was CEO always to encourage my doctor to do very advanced cases and to be #1 in doing these cases. Anyone who can read the newspaper will see always the news about Saudi German Hospital Dubai experience about many of the cases that was performed first time in UAE in a hospital which is only 1.5 years old. This case was cataract surgery for a 1-month-old baby, and actually we did it when the hospital was also 1 month. So even you need advanced anesthesia department, and you have to take the risk. This patient was moved by his family from clinic to clinic because not only the cataract surgery is simple, but to do anesthesia for 1-month-old baby, it was also a challenge for some doctors. This one done more than 1 year and a half back in the hospital. Also, one of the cases is the quintuplet cases that was done in our hospital 1 year back. I think many people will remember it. That this is the first case of second case only in UAE. The lady was pregnant with a quintuplet, and she came to our hospital. Many of the hospitals, government and private, refused to accept the case because it's a lot of danger for the mother and for the children. And you need the hospital to be really prepared, whether from the instrument, as I said before, and diagnostic instrument, and also from the manpower, because you have a mother who will have 5 babies at the same time, who are all underage, and they need all 5 doctors to be meeting them. This one was of the decision I took since 1 year when my doctor came and told me, should we take this case? And actually I told him, yes, we can take it. Although I didn't have enough number of doctors, although I was not fully equipped to receive them. But because I took these commitments and I was determined to let Saudi German Hospital Dubai be unique in the services that it will provide in Dubai, we took this challenge, and I prepared the department, whether from the manpower needed, from doctors and from nurses, and from the incubator needed. I prepared it within 4 months, and when the baby came, it was everything okay, and now they are, mashallah, in a good health. This is some advanced also retinal cases we do in the hospital now. We do very advanced cases in the urology department. This is first case of its type in Middle East, not only UAE, single port laparoscopy for kidney disease. We have also the colon resection by laparoscopy. We have very advanced laparoscopic surgery, and we encourage our doctor. Actually, tomorrow we have our first laparoscopic symposium in all specialty, because we encourage our doctor to go into the advances in medicine. We give them whatever they need from support, whether support by continuous education, support by the equipment they needed, and support from the management, which I think, in my opinion, one of the most important, when they get the support from the management. When you tell your doctor that go do this difficult cases, will support you, then he will have the trust. Otherwise, if the doctor will not have the trust with his management, even if you have one of the best facilities, and even if you will have one of the best doctors, if he's afraid little bit, especially in a private hospital in a country which might not be his home country, he will be afraid and not do anything. So to encourage our doctor to do and to do things which is advanced, and to bring the hospital to new levels of medical technology, we always give them the trust that they want and the support. We do the bariatric surgery, many cases done in our hospital, and the results were very good and nice, alhamdulillah. Cath lab, we do many cases per week of cath lab. We have very advanced cath lab. And many extra examples. Other issue, plus this one, we have then the infrastructure, the competent staff, the trust that we give to our staff to do unique cases that will achieve, bring the hospital and will bring the healthcare services into a new level. Also from the infrastructure, the IT system. I'll put a new chapter, full chapter for the IT, because I think IT is like the nerve system for the hospital. When you have a strong IT system, you have a strong hospital. Our vision in our IT department is to build enabled hospital from vision to reality. Our vision is to have paperless hospital, and as I said, we achieved already 85%. It's not easy to achieve, especially in a hospital, especially when you have doctors who are not used or don't like to work with computers and IT system and resist all the time. But by patience, day by day, we are moving closer into achieving this vision. Always in IT, our vision is to increase the quality of our services while improve our IT infrastructure. Of course, our dream always to be #1 and to give something unique, not only for Dubai, but for the whole area. What's the challenges that we face for improving or implementing the paperless dream for SGH Dubai is, of course, the workflow disruption, the managing initial cost. It's not easy always, the investments. The usability concerns, as I said, you always have resistance from your staff. They don't want to go into sophisticated system. They want to use the paper and the pen. It's their friend. And also the concerns about the security and privacy of health records. Why we are insisting to use the enabled system? Enabled system, which is the integrated health information system, will help the technician to track medical record. The patient will come to the patient, in a click, he will see the medical record of all the patients, and he can take more clear picture about the diagnosis. We are working now into something which is the chronic disease management. Chronic disease management is very sophisticated because it will connect the doctor with the patient, with the hospital, with the patient while he's in his house. This one will be the next step from our project, that the chronic disease management, the patient while he's in his house, he can check the blood sugar and he can send the data directly to his doctor and he can receive the advice from his doctor directly. Other focus on the IT is always to provide the mobile clinical assistant, that to provide the healthcare services to the patient bed. We have mobile computer, we have the tablets, so the doctors will go to the patient, the doctor will see the patient, the doctor will document everything while he is sitting in the standing in the patient room. This one will ensure for us that we are at the right patient, at the right time, at the right, giving the right medication, by the right dosage and the right route. No mistake. And in healthcare sector, you don't need any mistake. Our new things that Saudi German Hospital Dubai is doing now is the IPTV. TV that is over the internet protocol. IPTV will allow, as I said, that the services will come to the patient while he is in the bed. The IPTV, the TV, it's not only TV to watch Al Jazeera or whatever, any news. It's TV that the patient can see his bill, can decide what menu he wants to eat, can see who's the medical team that supervising his case, and he can see the profile of any of these medical team member. So this is enable the patient while he is in his bed to be active with the hospital operations and to see whatever he needs just by a click of a remote control in his hand. This one is already, we achieved 50% of this project, and the 50% inshallah in the coming 6 months. E-claim, which is now electronic claims. This one also was one of the challenges that Saudi German Hospital Dubai faced, and we were successfully finished, alhamdulillah. We were first hospital. We had difficulty at our startup because we insisted, with all our here insurance company, to follow the e-claim system. E-claim system last year was not implemented in Dubai, but we insisted to implement it in Saudi German Hospital Dubai. It was the only hospital who has 100% e-claim system since 2012, even before it was mandatory in DHA. Why we insisted in that? Because we know that this is always automation. Things will always lead us to better quality, to risk-free and mistake-free services. The e-claim system, it is the system that will connect all, will connect the doctors with their patient, with their insurance company payers, with the regulators, and with also finance and insurance department. This one I'm proud because we were first hospital in Dubai, big hospital that have the e-claim system 100%. SGH Dubai, because of its advanced and because we insisted on our IT department or our IT system, we were, as I said, awarded by DHA by #1 in EMR, which is the electronic medical record, in iSystem by Dubai Health Authority for 2012-13, and we are planning to get it in 2013-14, inshallah. Thank you.